one. Okay. All right, so we're going to go through the anatomy of the heart, and we'll talk a little bit about the blood flow too. So I'm going to go through the anatomy as I go through the blood, if that makes sense. So we'll follow that same path. So the blood starts off in the heart in the right atrium, which would be here. Okay, and the blood gets into the right atrium from the superior vena cava and the inferior vena cava. The blood dumps into the right atrium. That's what this structure is here. Okay, from the right atrium, it passes through the tricuspid valve. That's this valve right here with the cusps on it. Okay, and from the tricuspid valve, it goes into the right ventricle. That is this structure here. Okay, the right ventricle will squeeze and force the blood up through the pulmonary valve right here. This is the pulmonary semilunar valve. Okay, from the pulmonary semilunar valve, it enters this structure, which is the pulmonary trunk. Okay, the pulmonary trunk branches off into the pulmonary arteries, okay? And there's two that go into the right lung, and then two that would come back and go into the left lung. And then in the lung, we're going to drop off carbon dioxide and pick up oxygen. So now the blood is oxygenated, and it's going to come back up and re-enter the heart in through the pulmonary veins. That's this structure here. So these are the left pulmonary veins, and if you rotate the heart around, these are the right pulmonary veins, and they drop. The right pulmonary veins come back in, and they both enter the left atria, which you can't see very well because it's covered up by this pulmonary trunk. But that's the top chamber over here is the left atria. Okay? From the left atria, the blood is going to pass through the mitral or bicuspid valve. That's this valve right here, into the left ventricle. So this is the left ventricle. Okay? And then the left ventricle is going to squeeze, and that's going to push the blood up through the aortic semilunar valve. I don't know if you guys can see that, but it's actually inside the left ventricle, but it's this valve right here. That's the aortic semilunar valve. And then from there, it passes into the aorta here. And then from the aorta, it's going to go out into the body, which when it gets to the capillary level, it's going to drop off oxygen and pick up carbon dioxide, and it's going to return into the heart through the venous system, again through the superior vena cava and the inferior vena cava. Okay, so that's the blood flow through the heart. So let's just go through some of the bigs of the anatomy. This would be the right atria. Okay, this structure in here, you can't really see it because of the pulmonary trunk, but this is the left atria. Okay, and there's a wall in between the right and left atria called the intraatrial septum. Okay, this is the tricuspid valve. This one is the bicuspid valve. Okay, so these are the atrioventricular valves. So they go between the atria and the ventricle. The one on the right is the tricuspid. The one on the left is the bicuspid. This is the right ventricle. This is the left ventricle. Okay. These structures, these little cords that are coming down and attaching to the ventricular walls, these are the chordae tendineae, okay? And these attach to the papillary muscles in the ventricle here. This structure right here is the interventricular septum, so it's the wall that separates the right from the left ventricle, okay? This is the pulmonary semilunar valve. If you tell me pulmonary valve, that would work just fine. This one is the aortic semilunar valve. So the pulmonary semilunar valve goes into the pulmonary trunk. The aortic semilunar valve goes into the aorta. Okay. So this structure here is the pulmonary trunk, and then it branches off into the pulmonary arteries, which don't be confused because they're blue. They are still arteries because they're carrying blood away from the heart, and that's a definition of an artery. And this structure here, this is the pulmonary veins, and don't be confused because they're red. Same thing. This is where blood comes back into the heart. So these are the pulmonary veins. Okay? And I think that's all of the anatomy of the heart that I want you to know.